A very warm good afternoon and welcome to yet another session on Ankura Knowledge Hub platform. And I welcome all of you all who have joined us today. The topic or diseases which we are going to discuss about today can be very common, can be debilitating, and still we may not be aware about them. These are a set of rheumatological diseases, and to discuss about them, we have Dr. Anjani Gummadi with us here today. Welcome, ma'am.
Hi, hello everyone.
So Dr. Anjani is a super specialist pediatric clinical immunologist and rheumatologist. And, after her MD in pediatrics, she has specialized in clinical pediatric immunology and rheumatology from a very prestigious institute, which you all will be aware of, that's PGI Chandigarh. Ma'am, first of all, that, every parent would, after hearing the term rheumatological diseases, would want to know that what are these and can even children develop rheumatological diseases? That's what the topic is today.
Yeah. So before I start, I would want to say that pediatric rheumatology per se is a very lesser known subspecialty. There's very little awareness among not only parents, but also doctors about these diseases, because of which it leads to debilitating complications. So our main aim of this session is to sensitize parents so that they can at least suspect these diseases early. So coming to what are rheumatological diseases, these are basically inflammatory or autoimmune diseases. Whenever we are exposed to any kind of infection, our immune system gets activated. What it does, it starts fighting against the infection, it recognizes them as foreign, and then puts its all efforts to push the infection out of the body. And that is the reason because of which we are healthy. So an intact immune system is required for us to be healthy. But sometimes this immune system becomes hyperactive. That is, instead of not only detecting the infections, it starts detecting the healthy normal cells of its own body as foreign. So once these are detected as foreign, it starts fighting against the normal healthy cells, because of which it causes damage. So depending upon the organ or the cell which is involved in this process, the symptoms develop and the damage depends. In some diseases, it may be a single organ. In some diseases, multiple organs like liver, kidney, brain can get involved. Virtually, there's no organ which is not involved in these diseases. From head to toe, any organ can get involved.
Right. So, ma'am, are these diseases in children similar to the ones which are presented in adults?
Before that, I would like to talk about whether these diseases occur in children or not. So, most of them have a misconception that these diseases do not occur in children. Whenever I tell parents that your child has an autoimmune disease or your child has arthritis, the first thing that comes to their mind is arthritis is usually seen in older patients. Mm-hmm. So everyone knows about these diseases and they know that these only occur in older or adult patients. Contrary to this common belief, substantial number of children are also affected with these diseases. If we see for arthritis, in every 1,000 children, at least 1 to 4 of them will be having arthritis. That means it is a very common disease. Mm-hmm. And there are some diseases which are very common and they're present with fever, rash, and many of them are misdiagnosed. Mm-hmm. In adults and children, the diseases can be same. Like they can develop arthritis. There are some connective tissue disorders like systemic lupus, erythematosus, which can occur in children and also in adults. But the major difference is the way they present, the symptoms they have, and how severe they are. Yes. So in children, if we take arthritis, it involves the joint. So when a child is growing, and there's a growing skeleton has different requirements. They have unique needs because there is ongoing growth in children. If we do not treat these, it causes deformities, it causes impairment in the growth, and they ultimately have short stature, which usually does not occur in the adults. For example, another disease which is systemic lupus erythematosus. In adults, it most commonly affects women. In children, there is no discrepancy. Boys or girls, both of them can be affected. And moreover, when it occurs at younger age, they have more severe disease in the form of more severe organ involvement. They have kidney problems, they have brain problems, etc. And coming to not only the symptoms, the treatment of these children is also different as compared to adults.
Right. So in children, how early can a parent expect these diseases to present?
So it depends upon the disease.
Right.
As early as 1 year of age, children can start developing arthritis. And there are some genetic causes of these disorders also, which are autoinflammatory disorders. Here they have a genetic mutation in one of the genes causing these, and they will have symptoms as early as 1 to 2 months of age. But they're often misdiagnosed, and there is a lot of delay in diagnosis.
Right. So ma'am, first we can talk about what are the common rheumatological problems, as you've already mentioned some names like systemic lupus erythematosus and arthritis. So what are the common diseases that parents should be aware of?
So as I said, the manifestations of symptoms depend upon what organ system is majorly involved. Mm-hmm. So the most common one is arthritis. Childhood arthritis occurs in 1 in every 1,000 children. Okay. So these arthritis is because of the damage to the joint. There are 5 to 6 types of arthritis. Depending upon the type of the joint involved, the number of joints involved, they are multiple types. Among the arthritis also, there is an entity called systemic juvenile idiopathic arthritis. It is one of the commonest forms of arthritis in children. Here they come with a very common symptom which we see in children, that is fever. They come with only fever, rash, and over a time arthritis develops. So initially these children are treated as infection or some other general pediatric disease, and only when the arthritis develop, then a possibility of systemic juvenile idiopathic arthritis is considered. Then depending upon the organ involvement, the next one is the connective tissue disorders. These include diseases like systemic lupus erythematosus, juvenile dermatomyositis. So in systemic lupus erythematosus, children will have a characteristic malar rash on the face. That is, it will take the shape of a butterfly on the nose and on the cheeks. And these rashes are usually photosensitive. So parents typically say, my child has gone into the sun and this rash has flared up. And fever, they come with fever, rash, extreme fatigue. And in this systemic lupus erythematosus, any organ gets involved. The brain, kidneys, liver, many blood cells and get involved. So they present depending upon what organ is involved. Some of them can only present with seizures and fever, and they turned out to be systemic lupus erythematosus. The other disease which I said was juvenile dermatomyositis. This is a disease which is often missed because these, as the name suggests, dermatomyositis. Dermato means skin and myositis means a problem in the muscle. So they will have both problems in the muscle and skin. So when skin gets involved, they develop rash. Because of the muscle problem, these children will not be able to get up from bed, will not be able to climb the stairs, go up and down the stairs, or they won't be able to use the washroom properly. So because of this weakness, there's a tendency that they end up meeting a neurologist first because they feel that it is some neurological problem. But these children usually will have a characteristic rash. As I said, for SLE, these children will also have a rash on the face, which is photosensitive, and they also have rash on the eyelids and the hands. Right. The next group of disorders, which is very common in children, is autoimmunity of the blood vessels. That is called vasculitis, when the blood vessel is involved in the process. The two most common vasculitic disorders in children are Kawasaki disease and Henoxial and Purpura. Kawasaki disease is a major disease which has lot of morbidity, because the blood vessel which is involved in this disease is the one which supplies blood to the heart. These are called the coronaries. So when these are affected, there's a chance that these blood vessels of the heart get swollen, and sometimes if the disease is very severe, they get blocked. The easiest way to detect these, whether the patient is having Kawasaki disease or not, is prolonged fever. They will have rash, which can take any form, usually a diffuse erythematosus rash all over the body for the parents to understand. They will have characteristic redness of the eyes, redness of the lips, and extremely red tongue. In simple terms, the tongue would look like a strawberry. So it would have all those small papillae which you see on the strawberry. And many times parents come with the symptom that my child had fever and he has this tongue which looked like a strawberry. If any of these symptoms are present, parents should think that it is something related to Kawasaki disease. Another common vasculitis is Henoxial in Purpura. Fortunately, it doesn't have much morbidity, because it involves very small vessels of the body. So they will have some joint pains, abdomen pain, some rash, which actually improves, but they need long-term follow-up for any complications like renal complications or anything. They, as I said, they are patients who can develop disease as early as 1 to 2 months. These children generally have some genetic causes. These include autoinflammatory syndromes. That is, patients start developing fever, which keeps recurring in regular periods and does not respond to usual medication. Sometimes these are associated with rash. So these are called autoinflammatory. So any fever which is not responding to all these medications and which is occurring very periodically and was starting at 1 to 2 months of age, we should start thinking about these. Apart from that, autoimmunity in the eyes is also very common. So children cannot actually say that what's happening in the eyes. There are many layers in the eyes. They start getting inflamed because of autoimmunity, and gradually their vision will get reduced. So this is called uveitis. They will not have obvious pain. They will not have obvious redness. Only when it gets complicated, they get cataract, glaucoma, or decreased vision. So these are some of the most common
Right.
pediatric.
So as you told, ma'am, the symptoms of the disease will depend upon the number of diseases. I mean, so whichever disease the child may be having, on the basis of those. So I believe parents should be careful and they should monitor for any persisting symptoms or any progressive symptoms, and they should keep it in their mind that it could be this segment of disease also, and consult a pediatric rheumatologist for the same to rule out any such problem. Besides, ma'am, what is the type of treatment that can be expected or can be offered for children in such conditions?
So coming to the warning signs for which the parents need to look for, they will be very non-specific. Actually, diseases of pediatric rheumatological manifestations per se are non-specific, because as I said, these symptoms evolve over a time. So once initially they may have fever, then the rash, and then they start developing joint symptoms. So the symptoms will be evolving and sometimes overlapping with some other common diseases. For when I said the child is having muscle involvement, so upfront, anyone who sees a child like that, they will say it is a neurological problem. So symptoms are almost always overlapping with other diseases. So there are few symptoms which their parents can look for and be vigilant. These include fever. If a fever is subsiding, and if it's subsiding immediately with drugs and we have a cause, then nothing to worry. But if fever is coming recurrently, and if the fever is persistent and prolonged, not responding to any antibiotics, if the fever has no cause, unexplained fever, then we need to think of rheumatological diseases, because in most of the cases, fever is the initial presentation. And coming to the joint symptoms. So joint pain, joint swelling, are some of the easily picked up symptoms. So you can see obvious swelling around the joints, that is the knee, elbow, or wrist. And some older children can point out and say, I have pain here, I have pain here on movement. But the problem comes with the younger children who cannot tell what is actually happening. So these toddlers will be extremely irritable. They will not let us touch the joint. And moreover, there's a cardinal symptom for arthritis, that is morning stiffness. If you see a child who starts developing pain immediately after periods of rest, that is, once he gets up from sleep, they start to limp or they are extremely irritable, that means there is some problem in the joint. Or if they notice any change in the gait, change in the limb, that is also a feature which should not be ignored. Skin rash can take any form. Skin rash, especially the ones on the face, which are photosensitive, need to be addressed immediately. Some rashes which come with fever can occur in systemic JIA. As I said, Kawasaki disease, Henoxial and Purpura also have this rash. So fever with rash, if viral infections are ruled out, then we need to think about rheumatological causes. Apart from that, some common symptoms like extreme fatigue. Your child will stop doing activity which he or she loves to do. They will always prefer to sit. Extremely, they get tired. If there's loss of weight, loss of appetite, we need to think that there's something wrong. And some of these patients with especially systemic lupus erythematosus will have excessive hair loss. They will have recurrent oral ulcers also.
Right. So, ma'am, again about the treatment aspects, and also, ma'am, if these are progressive diseases, then can they be cured completely? Two things which probably.
So, coming to the treatment, there's a lot of misconception that once a rheumatological disease is diagnosed, that there is no cure. And over last 2 decades, there has been significant improvement in this part of treatment. And even if we diagnose a child per se with arthritis or SLE, and if they're treated on time, they can have a healthy, normal life. These children can grow up to become normal adults, study well, do the activity or hobbies of their choice, and lead a good quality of life, provided these are treated on time and appropriately. So, as I said, the whole cause for all this is hyperactive immune system. Your immune system is recognizing your own cells as foreign. So, we need to stop that. So, we need to give drugs which stop this hyperactive immune system. These include various drugs like steroids, intravenous immunoglobulin, and many other steroid-sparing agents. For acute illness like Kawasaki disease, the standard of care is intravenous immunoglobulin and aspirin. For some cases like arthritis, the treatment would depend upon the joint involved. If a single joint is involved, a small injection at the joint site will reduce the symptoms. If multiple joints are involved, they will start requiring oral drugs. Or if it is very severe, they will need steroids which need to be given through injections. The other misconception majorly in what we see in our practice is about the steroids. As soon as I tell parents is that this child needs steroids, they go into a panic phase. That is because everyone knows that steroid reduces the immunity and there's always a chance for increased risk of infection. That happens when these doses are given in very high doses and for a very prolonged duration, and when they're given unmonitored. In a supervised setup, when we give these drugs and the children are regularly monitored, the side effects are less. Moreover, the few side effects which occur with steroids, like they decrease the bone density, they cause some weight gain, some of them can develop high BPs. And so these have to be regularly monitored by the doctor. Because we cannot give steroids for a prolonged duration due to risk of all these side effects, we tend to start the patients on few drugs which are called steroid sparing agents. These include something like azathioprine, methotrexate, etc. And the choice of the drug would depend upon the type of the disease and also the organ involvement.
I mean, yet again, how prolonged is the treatment, and can these diseases be, the parents expect them to be cured, or the children not having medication after a particular point in time?
So symptoms, as I said, depend upon the organ involvement, and so is the treatment. If something which is like acute in onset, the treatment is also very acute and brisk. For Kawasaki disease, they need intravenous immunoglobulin, which is a one-time treatment, and then they will need to be monitored throughout for any complications of the heart. If there is nothing much major, these children will do very well, and they can do any normal activity. But some diseases like systemic lupus erythematosus are actually chronic diseases because it's the body's reaction to its own cells. So this is going to be there in the body throughout their life. But what we can do with the medication is we can control its activity. So with proper drugs, proper duration of drugs, we can keep this immune system in our control. And definitely, I would not say that these are completely cured and out of our body, but definitely they are treatable.
Besides the medication and other treatment aspects of these diseases, are there any lifestyle measures also which can limit the progression of these diseases or ease out on day-to-day activities for children?
Sadly, there is no preventive measure. There's nothing that we can do to prevent these diseases. But I would suggest a healthy lifestyle, at least the children who are having these rheumatological diseases or the one who are at risk for these rheumatological diseases should have a healthy lifestyle. These include at least 20 to 30 minutes of physical activity, a healthy diet which includes a balanced diet, and adequate supplements of calcium and vitamin D, which helps bones healthy. Moreover, apart from the medical management, these children will need a lot of psychosocial support, both from the family and the doctors. And because it's not a single time disease, it's a chronic disease, they will need reassurance, they will need dietary advice, we need to monitor their growth, and we have to look into their vaccinations. Because as children, most of them, we know pediatricians, the most important part of a pediatrician is to vaccinate all the children who come to them. But these children have some risks with some vaccinations, especially when they are on high dose immunosuppression. So some vaccines need to be skipped. And for some diseases, additional vaccines needs to be given. So all these will be in a multidisciplinary approach. If the child is developing organ involvement like kidney involvement or some brain involvement, then a team approach with the neurologist or nephrologist, and sometimes they develop gut issues, then we need a gastroenterologist. But the main anchor here would be a rheumatologist who can keep everyone in a loop.
Right. Any advice, any last words of wisdom for parents who may be, in misconception to visit a rheumatologist, or parents of children who already are having rheumatological diseases?
So one thing I would want to say is these diseases, if diagnosed late, because routinely we see they come to us with a delay of 3 to 12 months, because of which there's a lot of complications. Like some come with the damage in the heart, some come with the damage in the kidney. Once the damage occurs, these are irreversible. So our main aim is to prevent the damage from occurring. So all the children who already have a rheumatological disease, I would suggest their parents to go on a regular follow-up, to maintain visits at least every 2 to 3 monthly, take advice on their growth, vaccination, and nutrition. And especially the children with arthritis should have physical activity at least for 30 minutes in a day. and they should do physiotherapy, if not 30 minutes, at least 15 minutes a day, because that will help them in a long run, and after which only we will be able to taper some of the drugs.
Sure. Thank you so much, ma'am, for a very, very fruitful discussion. And, I'm sure so many parents will be aware about these conditions, which, as you mentioned, are rare to be, aware about. And Dr. Anjani Gummadi is an exclusive pediatric clinical immunologist and rheumatologist practicing at Ankura Hospital, available, she's the only pediatric rheumatologist available in the entire twin Telugu state. So, that would give you an insight of how rare these conditions would be. And thank you so much again for giving us such valuable information.
Thank you. Thank you.
Thank you.